tell, it's National Wear Red Day, and it's
is.
part of the American Heart Association's Go Red for Women movement.
So why go red? Because heart disease is the #1 killer of women and men. Amanda Mills is here from the Heart Association of Cincinnati, along with Dr. Eugene Chung from Christ Hospital. Welcome. Happy Friday to both of you. Amanda, let me start with you.
Yes.
It's the #1 killer in part because a lot of women don't recognize the symptoms or don't get checked, right?
Absolutely. We know women are caretakers and always taking care of everybody else before themselves, and sometimes our own health comes last. So that's why this day is so important, to make sure that we are aware and paying attention to our bodies.
And Doctor, what other reasons are there that we're finding so many women having these issues? Is it because we're becoming more aware that they exist, or are we seeing different changes in diet, or why are we seeing so many problems?
The same things that cause heart disease in men cause heart disease in women. And they've existed forever. I think the awareness and attention and focus on it has grown appropriately. I think for years there was a narrative that women develop heart disease less, but that's just not true. And it may happen a little bit later in age, but it happens just as frequently for the same reasons. So the awareness has gone up, and attention to it from physicians and nurse practitioners, as well as the public, has gone up. And organizations like the AHA has made a huge difference in leadership in that regard.
Well, the great thing about it is we have some control over whether we have heart disease or a stroke with our lifestyle and what we do, right, doctor?
Absolutely.
Yeah, what can we do?
A significant portion of heart disease is genetic, perhaps half if you can estimate that. But the other half is lifestyle interventions and environmental. So smoking, #1 issue, don't do it. And a healthy lifestyle that includes exercise and an appropriate diet. I think those are the main things. And then being aware of your symptoms and what can happen, and not underestimate those issues.
Are you finding more people coming to you that get genetic testing done? You know, a lot of people are doing these DNA testing kits. Like, for example, I found out through DNA testing that I have a genetic mutation that makes me, it's actually fairly common, but apparently it makes me more susceptible to some cardiovascular diseases. Have you had people coming to you more and more now?
More and more. It's not a good thing necessarily, because a lot of this data that says you are quote unquote more likely to have heart disease is not solid. It's pretty vague.
Okay.
Still, the most important things are the big ones: smoking, diabetes, high blood pressure, family history, cholesterol. Those are the big issues for coronary disease. There are some diseases that are genetically related, but not generally the ones we're talking about.
Okay.
Amanda, our last question is this: where can people find out more information? Where can they go and have some fun and maybe raise some awareness this month?
Absolutely. You can visit our website at heart.org. We have lots of great resources on there. Whether you want to learn more about heart disease or have some great recipes or ideas to get moving more, you can visit our website. And then obviously we've got lots of opportunities coming up over the next couple months to be involved. So we have the Heart Ball, the Mini, so everybody can sign up for that and participate, walk or run. And then of course Go Red for Women in April.
Very good. Amanda, Dr. Chung, thank you so much.
Thank you.
Thank you.
Appreciate
Appreciate
the
it.
information.
Yeah, make sure you visit that website to find out what we can all do to keep ourselves healthy.
We'll make it
Yeah.
easy. Put it on
There you
local12.com
go.
for you, and we'll be right back.